So I am Dr. Meena Cherian, and I used to be former WHO staff, leading the program on surgical care for several years until I finished my term and retired from there. So then I joined in the Geneva Foundation for Medical Education and Research, which is a Swiss foundation, a non-profit foundation. And I joined as director for emergency and surgical care in that foundation. And their role is basically, in fact, they have a long experience on developing education online courses, from reproductive health, child health, to even cancer and research methodology. And I was involved is because very recently, 3 months ago, we've just launched our emergency and surgical care in the context of universal health coverage online course, which has been taken up very, I would say, by 976 participants from 41 countries in these 3 months. So that got me also thinking that, SIOG has its priorities. It's just announced its 4 priorities, and one of them is education. And through this education, it also links to the universal health coverage, the SDG targets, which is on strengthening the health workforce. So SIOG, I've seen that SIOG has done a huge amount academically on research, on clinical publications, clinical best practices, and also on education. It's having advanced courses, etc. But there is a gap. There is a gap in public health education. If we are going to say, if we know that the aging population, in fact by 2030, 60 years and above people will be more than children 10 years old by as early as 2030. So isn't it time that we really start bringing this awareness, raising this awareness amongst people who are interested in population health? Because academics, yes, we understand that they would be more interested in clinical publications and research publications. But if we are wanting to give this message and giving it widely so that people would understand how we have to think in an integrated care for the aging population when they are detected with cancer, for a better quality of life. And this is something, with my experience in many low and middle income countries, when we are talking about aging, we should also look at why people do not get timely, optimal care. One is because they cannot reach the quality essential health services. The other is they do not have awareness that there is a problem, and so they do not communicate at the primary level of health, especially with the community health worker. That is for all diseases, people go to them most of the time. I'm talking rural population and the thing. So nobody straight away goes to the tertiary care. And this is something that for cancer in the aging, it needs to be detected early, needs to be diagnosed, it needs to have treatment, the best treatment, it needs to have also rehabilitation, and also for a good quality of life, palliative care, which encompasses, it also includes supportive care. And this is all very integrated with the family, community, and not only just at the hospitals. So Geneva Foundation for Medical Education Research, as I said, with its long-standing experience on distance learning courses, we can collaborate with SIOG in developing similar courses like we have done, distance learning, which would be clearly on integrated cancer care in the aging in the context of universal health coverage, and it will be public health course. The materials to be, the resources and the materials to be utilized in this short online course would be only the WHO materials, which are publications already there, and the SIOG publications, because they are already there. They have wonderful publications already. This will bring a very short, could be 1 hour to 3 hours or something, because I find short courses would be the answer, where people who are interested in all other public health topics would also be interested how we are talking about in aging programs about cancer, in cancer programs about addressing aging. So it will mix the two. So one is that it will create this the awareness, raise the awareness amongst the public health people, but also it's also a education and training tool for even the people who are already specialists, to look at the challenges of cancer and aging, look at what could be the solutions, what the World Health Assemblies, all those resolutions that we talk about, what they have proposed, what the countries want, and how as a policy you can make a change what you want to do.